webinar today. We're very excited. I'm going to have Dr. Brett Carter and Abby Bass introduce themselves here shortly, but I'm David Wyrick, Professor of Public Health Education at University of North Carolina, Greensboro. And we have been working collaboratively with our Division of Student Affairs here at UNC Greensboro to, I think, take some innovative and comprehensive approaches to thinking about student well-being, especially in the time that we're living through currently, and the challenges that face our students. And in doing so, we're going to also introduce you to a new web-based behavioral intervention that we have developed with funding from the National Institutes of Health. It is the first online behavioral intervention targeting student well-being that has gone through a formal optimization process. What we mean by that is the program is called itMatters, student well-being. And by optimization, what we mean is that the components of the program, the modules themselves, have been optimized to the outcomes that they target, meaning that we've gone through a process to maximize the impact of those modules on the outcomes that we're targeting. And this was a very innovative grant. First time a process like this has been funded by NIH. And so we're excited to tell you a little bit about it. I'm not going to go into detail on that today. We'll have a follow-up webinar to get into the science and the evidence base of itMatters. But just wanted to give you that little bit of background. So when we talk about student well-being, what are the topics that we're covering with itMatters? We're targeting factors that are very relevant to college students' lives. So we're targeting alcohol. We also take an interesting look at the intersection between alcohol use and sexual risk behaviors, and kind of the overall topic targeted there is prevention of STIs. We also target mental health, sexual violence prevention, sleep wellness, stress management, and so as you can see, we take a very comprehensive approach to student well-being. And so with that brief introduction to itMatters will obviously be part of our conversation today, but we're going to talk more broadly about student well-being and how you can collaborate across campus to hopefully promote the health and well-being of all of our students. So with that, Brett, why don't you and Abby introduce yourselves, and then I'll kind of jump into facilitating some conversation between the three of us.
Thank you, Dave. Brett Carter, I'm the Associate Vice Chancellor and Dean of Students here at the University of North Carolina at Greensboro. Been here 26 years, and in the last few years working with Dave's team, this has been a really great collaborative partnership, and I'm looking forward to having the opportunity to kind of sort of share a little bit about our experience and hopefully, inform kind of sort of why itMatters is a unique product to have and to implement on campus.
And I'm Abby Bass. I'm the Director of Curriculum and Development for the Institute. And I also lead the implementation team that manages all of our online programming. So my role is helping with how we can implement and distribute programs like itMatters on college campuses.
Very good. So as the facilitator today, I will try, I'm the researcher in the group, so I'll try not to go too much to the research side of things, because we really want to talk about the application of itMatters or any type of online programming that your university may be using. But how can we collaborate more effectively across campus to do a better job of meeting the needs and demands of our students? And so with that, Brett, I'd love for you have such a unique perspective on this. You obviously, as the Dean of Students, you are very attuned to what the challenges that college students today go through. You've been in this role for a long time, so you can compare back to think how things have evolved over time. So I'd just love to hear your kind of general thoughts about what are the well-being needs of college students today?
Thank you. And I think that's a really good kickoff question to kind of start things off. As someone who's been in the profession for many years, certainly this whole concept, and one of the things that we have implemented here is this thought around creating a culture of care. And within creating that culture of care, student well-being has always been a priority. Certainly in recent months, obviously with COVID, that has kind of sort of exacerbated things and really emphasized the need for us to really focus on student well-being. Because here's what we know. We know based on the literature, we know based on research that we've done on student engagement on our campus, that depression, anxiety, and social isolation are critical areas that are impacting our students. And we need to be very creative in looking for ways to engage our students and give them resources to be proactive. That being said, we were very, very fortunate to be the recipient of the 2015 Healthy Minds Award, which is given to campuses for their efforts in promoting student well-being on campus. Very few campuses get that. It requires a lot of data and information to provide. And so that just reinforced our desire and goal and purpose to really focus on student health and well-being. Yeah.
You know, when I think back, Brett, to how we kind of first started working together on this, you know, it's interesting for the practitioners on this webinar to think about kind of what your role is, and then maybe to hear a little bit about my role as a research team. So we put together a research team who has a lot of kind of research expertise around these topics: alcohol, sexual risk behaviors, mental health, sexual violence. But that doesn't necessarily mean that we're really great at translating our research knowledge into practice that would be useful and valuable to students. And so one of the things that you recommended when we first met was, hey, we need to get kind of an advisory team put together. You know, who are the important departments and people that are on campus at UNC Greensboro that can take a look at the content of itMatters as you're designing it and developing it and testing it, and help inform it so that this is something that's truly applicable to our student body at UNCG. And I didn't know if you wanted to talk a little bit about that process, or who were some of the people or departments that were represented at the table when we had those meetings?
Absolutely, and again, it was by chance, because we were at the end of our contract with a third-party vendor, and we were trying to come up with some a creative new model to address the needs of our students. And as you recall, we kind of sort of met by chance in our food court area, and it was just a perfect conversation at the right time, where we were talking about some of our needs. And so when we got into those conversations, we realized that not only did we have folks, researchers who've been doing this for years, but we also recognized that on the student affairs side, the practitioners who are on the ground doing the work, we recognized that we could create a really great collaborative relationship to kind of sort of inform the work that we do. And that's one of the things that I liked about working with your team, is throughout this entire process, it was very collaborative. We had an opportunity to kind of do a lot of customization to our campus. We incorporated a lot of data. And so some of those people we brought to the table were our Title IX coordinator, our Center for Student Wellbeing, our Dean of Students Office. The mental health side, we had counselors at the table, and as well as other resources to kind of sort of inform the work that we were doing. And so at the end, we produced a really great product that really had our students engaged throughout the process, and especially during COVID. That was one of the things that we were very intentional about. We realized is we wanted to keep our students engaged, and we wanted something that was going to be very interactive, not just giving them information, but gives them an opportunity to kind of sort of be involved and participate in the process.
Yeah. So when I think back to those meetings around the table, you know, there were a couple of things that hit me. One is, you know, this idea of bringing people together on campus to address an issue, that's not a new idea, right? That's a best practice that's been in place, you know, to get multiple universities tend to respect the process of getting multiple voices and opinions and collectively, coming out with something that has broad benefit.
Absolutely.
But what's interesting is we had a very specific project to work on. And so the dynamic was a little different. I've been in plenty of meetings where we pull people around the table and there's discussion about strategic plan or goals and objectives for the organization, and thoughts can be kind of all over the place. But with this, we had this funded project from NIH to develop this web-based behavioral intervention targeting these topics. And so kind of everybody knew what their role was. And it was interesting from a research team perspective, because our research team was part of that group around the table. We had all this substantive expertise that you collected for us.
Right.
And then we were able to say, okay, here's the content that you're recommending around sexual violence or around alcohol. And we know what is it that we're trying to change. So when you're putting these teams together, you got to be very clear on what you're trying to accomplish. We knew we were trying to move social norms. We knew we were trying to have a positive effect on behavioral expectancies. We knew that we were targeting self-efficacy around problem behavior strategies. And we knew that we were targeting just kind of knowledge and awareness. And so, like, we were able to give, I think, your team some very clear objectives of what we were trying to achieve.
Absolutely.
The content recommendations, and then make sure that both sides were translating things well to meet those goals. And then the process that we went through was this kind of formal optimization methodology where we're trying to see if we can really maximize the impact of each of the modules on those outcomes, like norms, behavioral expectancies, self-efficacy. And so it was just it was a great exercise to go through. And I think what we landed on, really meets college students where they are. And if you, Abby or Brett, want to just talk about maybe how we're using itMatters at UNC Greensboro currently.
And I'll interject and say, so how we're using it. And again, as with any type of web-based programming and where you're gathering information, one of the other key factors is you want it to inform your practices. You want it to inform the work that you do. And so a lot of the data that we were receiving, the information we were receiving from our students, really allowed us an opportunity to kind of sort of change, stop doing, or enhance some of our programs that we were already doing, so that students can see the connection between the survey itself and how we are implementing it in the programs. So that was a very critical and important piece for us, is being able to inform the work that we do so that we can continue to stay relevant. That's one of the big key factors for us in terms of student well-being, is making sure our content and our programs are relevant for our students and for what they're going through at that moment.
I'd like to stick maybe with since you brought this up, Brett, maybe stick with the data piece for a minute, because there's an opportunity that we all too often that we don't take advantage of when implementing a program, whether that program be face-to-face, in person, or whether it's delivered online. But through the implementation process, we have these opportunities to collect data. And those data can be used to evaluate what we're doing to see how well it's working, but it can also be data that we're collecting to kind of find out where our students are, what they're dealing with, and what needs to be taken into consideration moving forward. Abby, do you want to just talk briefly about how we integrate data collection into what we're doing here at UNC Greensboro?
Sure. So we use a relatively easy process for data collection. When we start to really talk about implementation, one of the key things we like to focus on is simplicity, making it simple for the campuses and making it simple for the students. So that's really our goal, and that comes into play when we think about how we're going to collect the data. We really integrate the data collection into the delivery of the programming, so it ends up being a really, really smooth process for the students and for the campuses.
Very good. And so, Brett, you've already talked to how we use the data at UNCG. So I'll speak just from a research perspective. Is the data allow us to contribute to the scholarship around these areas? So we can use the data to publish academic manuscripts, white papers, present at relevant professional conferences, can build opportunities for professional development across our UNCG faculty and staff. There's just a lot of utility with the data that we collect. The most important being, are we doing a good job serving our students? You know, is what we're doing having an impact? And two, making sure that we are on top of what the current needs of our students are and projecting that out forward. So with that being, Brett, thinking about the needs of our students today and the topics that itMatters covers, so like mental health, sexual violence prevention, alcohol, all those topics. What are you hearing from our students right now? The students as they're coming on the campus and what they're dealing with, what are they saying, and how do you think itMatters is helping them?
Well, and so what we're hearing from our students, and that's one of the, as it relates to, you know, when we think about these elements, we're talking about campus safety overall, and we're also talking about student well-being overall. Yeah. Our students want to be successful. We want them to be successful. And so we have got to create opportunities for them to engage in our resources. And I think one of the really out the gate benefits was that it exposed students to what resources we have on our campus, because oftentimes we hear students say, you know, I'm struggling in this particular area, but I don't know where those resources are. And itMatters kind of sort of engages those students in terms of that assessment, where meeting them where they are, and then at the end product is it, and here are a list of resources. Because one of the things I stress to anyone that comes to our campus is we are a resource-rich campus, and we got to leverage that. And how do we leverage that is any opportunity we can through any research, through engaging students in surveys or assessments. Those are opportunities to try to get that information to our students. So that was one of the things out the gate students were telling us, is that, yeah, even with our first year students who are majority or are required to take itMatters, is that when they got here, they felt like they knew where the resources were. And any data will tell you that for students to be academically successful, they have to be in a place where, at a campus where their well-being is kind of sort of viewed as a priority. And so that's one of the things that we appreciated is again, what our students tell us is it exposes us to resources prior to us getting to campus, and we arrived on campus, we see those resources, and the faculty and staff are engaging us in terms of connecting with those resources. So that, I think that's critical.
Yeah, and probably not talked about enough, you know, not only in terms of directly what the intervention or the program is targeting, but also raising awareness of this campus community and how that this community is uniquely positioned to help support them. Because it can only support the student athletes to the degree which they engage with it, right? And so if they don't really understand, or if they're not aware of all the resources that are available, and we know what it's like coming in as a student to campus, you're just being hit with so many things at one time. And the primary focus is always going to be on the academic side. And so, yeah, making sure that we're taking advantage of the multiple opportunities we have to raise awareness with the students about what resources are available, how do you get in touch with them, is critical.
Exactly, and similar to that, you know, as also helping our students to also themselves be champions and getting their peers to take advantage of these resources. I mean, again, in addition to helping them to know where these resources are, it's also, you know, and part of one of the things we kind of sort of stress is also how can our students be champions in getting students connected to these resources. They themselves might not need it in that moment, but being champions to get other students. And that's kind of sort of the feel. And that goes back to what I was sharing earlier about this whole concept of culture of care. This is just the, you know, one of many pieces that kind of sort of helps us promote that feeling on our campus, where students are saying, yeah, while I'm on campus, they really live this culture of care attitude or belief.
Brett, I know you mentioned that itMatters is one piece of what we're doing. Just for the audience, people who are really, I think, trying to maybe think through what they can do comprehensively on their campus to create that type of culture of care, really promote student well-being? Are there some other things that UNCG is doing, or things that you are aware of in your role that other campuses are doing that you think are worth highlighting?
Well, and part of that is just being intentional and creative. And so my point is you got to create many avenues. And so other things that we've been exploring. So in working with our counseling center, we have gone to a system where we are able to provide 24/7 support to our students related to that mental health. The product, I mean, it's referred to as protocol, but again, we even inform them based on the information we receive through itMatters of what our students are telling us, so that when those students are making those phone calls, it is, again, I go back to, and I know that's kind of sort of a word used a lot, this customization is, we want that student to have an experience uniquely to UNCG. So we've kind of sort of done that. We also are in the process of implementing our a comprehensive student well-being model, where we are bringing in, we're going to be training academic coaches, peer academic coaches, again, sharing this information with them so that they can provide that peer-to-peer support with them. And also just in general, and again, I think you kind of hit on it, is as a resource-rich campus, that collaboration piece. We have a nutrition department on campus. We have our nursing program. We have, your area, public health. Those are things that we are intentionally seeking out those relationships so that we can, provide more support to our students.
That's great. Yeah. And so, as is becoming very evident in this conversation, we've worked hard to get to the point where we are now. There's still lots of improvement to be made, right? There's always the challenge of limited resources and to be able to do everything that we envision. But we have, I think, uncovered some very important best practices for how to really integrate an online program like itMatters, regardless of what online programming you may be using on your campus, into the overall effort. Who do you target with it? What are the topic areas that should be important? What is the evidence base that you should look for when choosing an online program? I mean, we've really outlined some important best practices. So, we've kind of gotten to the point now with UNCG is where we're ready to share those best practices. We're ready to share itMatters with universities that would be interested in taking a look at it. So with that in mind, Abby, I don't know if you want to speak to kind of how we're currently implementing itMatters at UNCG and maybe what it might look like if a university wanted to adopt it for use on their campus. What kind of support will we provide? Those types of issues.
Sure. Yeah, so our team has been doing a lot of implementing of online programs for many, many years. And so in doing that, we have really started to focus on a couple of things, I would say. It's got to be simple, and that means easy for you, the people who work on the campus. Everybody on a college campus already has a lot on their plate. So our team tries really hard to do a lot of the work to get the program implemented. The other thing we really try to focus on is adaptability and flexibility. So another thing we know is not all campuses are the same. Not all campuses have the same needs. So just like with the programming itself, we customize it to have your school-specific resources. We can also customize our implementation process to work in a way that will work for your school. So that being said, we have a basic process laid out. You and your team at your school would just pick out the courses you want. You can decide, different schools might decide they want different groups of students taking certain courses. And you pick out the dates, things like that. You'd have to, and our team will help you talk through those ideas, figure out kind of exactly what you need to think through when you're kind of determining what you want your plan to be. And then with just a little bit of information, our team can really take it from there and do kind of a lot of the heavy lifting of getting the students set up and enrolled. And, we can even do the communication to the students. So we help, sending them their the information about the program. It's really something we try to do as a team with the campuses. But we can do all the communication, the reminders, making sure that students are getting the programming and getting access to the programming that they need. Yeah, so yeah, we try to make it simple, but then at the same time we can adapt to what each campus would like to do. So and that might look like a lot of different things. We have campuses that make lots of different decisions. Just, you know, maybe a campus wants to handle all the student communication. That's perfectly fine. We can set you up with templates and set you up with everything you need to be able to do that. So so our team really emphasizes being flexible and helping your team figure out how this can work best for your particular campus and your particular students.
And Abby, I can't help but stress, I mean, everything that you described, I mean, just kind of sort of doing all the heavy lifting. I think the other piece that I would add too is from a compliance standpoint. We know that was critical for us when we went down that road. We know that as our campus partners or our campuses that are on this call knows that the federal government, as it relates to Title IX, there are things that we have to make sure that we're doing for our students. And that was one of the critical pieces. And I kind of sort of, that was one of the things that I appreciate about this particular product, is that it does meet our compliance requirements, as well as, like you just shared, just a lot of that heavy lifting was very appreciative for when we implemented it on our campus.
Yeah, and I'm glad you mentioned the compliance piece, Brett, because I know not only did we take advantage of the Title IX expertise at UNC Greensboro, but Abby, we also reached out to other Title IX directors or coordinators around the country to get feedback to make sure that, in particular, the content of our sexual violence prevention course meets national standards and meets the needs of colleges and universities in the U.S. I don't know if there's anything you want to add to that.
Just that also goes along with the customization aspect, which we haven't talked too much about during this webinar, but we probably will on the next one. But itMatters allows schools to customize with things like their own resources. So when the reports you have to share and links to particular websites, those can all be integrated, and we help you get all of that out to the students easily.
Yeah. And can you speak at all, Abby, is the data collection piece of itMatters, is that also customizable to each campus?
It can be. Mm-hmm.
Yeah. So obviously we kind of have a core survey that we would recommend using that we believe, you know, helps one kind of ongoing evaluation of itMatters, but also is measuring things that are very related and timely for student well-being. But if you've got some unique data needs at your campus, we can certainly figure out solutions to integrate those into what we're doing. Is that safe to say? Mm-hmm. Okay. All right. Let's think about what needs to be done if someone wants to learn more about what we've done at UNCG, kind of how it's informed what we're doing moving forward. They want to learn more about itMatters. Maybe they want to see a demo. Talk to us about the research behind itMatters. You know, whatever their inquiry might be related to. What's the best way, Abby, for them to get in touch with us?
Yeah, so really easy. Just send us an email. You can either respond to the emails you've already received about the webinar, and those will get to me, or we'll also send out a follow-up email as soon as, or a little while after we're done, and that'll have my email address. And just send any questions my way, and I'll make sure that I get you connected to the people you need to be connected to, and we can set up demos, and we can set up phone calls for more information, and we'll get things going.
Hey, I was trying to keep notes while you were speaking, Abby, but did you speak to use of itMatters with upperclassmen or even graduate students?
I didn't yet, but it's definitely, you know, that's a campus decision. It is, I would say it's definitely content that is relevant to anyone who spends time on a college campus. one of the things we do that's really, I think, unique and specific for not just new students is for our sexual violence prevention topic. We actually have a series of lessons on that topic. So those are intended to be taken kind of in a sequence. So you might have your first years take one of those, and then you could have your sophomores, your juniors, your seniors take one of the follow-up sequences. And the purpose of that is there's always the first one's the foundation. You always want to make sure you give that foundation every single year. It's not something that just one hearing it one time is it's always better to have that reiterated in a different way. And then each of those pieces of this series do a deeper dive into part of the content. So that's a really good way to use this programming with not just first year students, but older and continuing students as well.
What are some of the topics, especially related to sexual violence prevention, that we do a deeper dive in and throughout the series?
So right now we have we have the core that is the intersection of alcohol and sexual behaviors. Then we have our sexual violence prevention core. Then we have a sexual violence prevention consent. So we start that course with a kind of a recap of everything that's in our foundational course. And then the second half of that module is really focused on consent and having some more interactive activities around that. And then we also have one that's focused on upstander strategies. So how to help your community members, your friends, how to know when to step in, those sorts of things.
Brett, is there, I know the training, how critical the training around being an upstander is on college campuses right now. Is there anything you want to add to the role of upstanders or the importance of them?
No, I think it's kind of sort of been emphasized. Obviously it's a critical component to what we do, what we do for our students, and creating that opportunity for students themselves to take an active role. And I think that's has always been a critical piece in all this. Is I always kind of say we're all in this together. We all play a role. It's not just faculty and staff, but it's all of us. And how do we all kind of sort of contribute to that, creating that safe environment for our students?
Yeah, I know in the work that we've done with the Counseling Center, how important that upstander role is in terms of helping students find their way to the Counseling Center and get the help and the treatment that they need. I know from my own college-age children and some students that I've got this semester, the most consistent thing that I hear right now is how overwhelmed students feel. Mm-hmm. And coming out of all everything that happened during the pandemic, the adjustments that have been made on college campuses, and some of those adjustments we're sticking with, we're coming out of some of those adjustments and returning to somewhat normal. I think some of the students, or a lot of the students, were just really having a tough time with that transition back out of the pandemic. Are you hearing the same thing in your office?
Absolutely, absolutely. And again, we it's hard to think about, but as we had to pivot very quickly. And even then, when we were coming back, we had to take what we've learned and try to kind of sort of create these, what I call these hybrid learning opportunities, with the combination of in-class and out-of-class experiences. And same with our counseling center in terms of how we delivered our services to our students. So again, from in-person appointments to online appointments, and actually, again, we learn a lot of good lessons from all that it allows us to be more intentional about how we're reaching our students, and we're able to reach more students too, just by the different resources. So we learned a lot. And again, as I mentioned earlier, all that learning has informed what we do and how we work with your team to make sure that we are staying relevant in terms of the content that we're delivering to our students.
Yeah, absolutely. Well, to maybe start to wrap things up, we were wanting to keep this about 35 to 40 minutes. I want to go back to the research side for just a moment, because we are going to host a second webinar that's going to dig into the science of itMatters and the details of the NIH study that we were funded for the research and development around itMatters. But I want to make it clear that of all the, and you know, over my 20+ year career, I've been involved in a lot of NIH funded research and development projects. And this has been the most collaborative approach that we've ever taken in this process in terms of voices at the table and how it informed our work. And I want to make it clear that, you know, it's not as simple as just putting some content about mental health or putting some content around sexual violence, putting it in an online format and delivering it to students and hoping that it's going to have a positive effect on their well-being. Really, the science behind this project has a tremendous amount of rigor in terms of what were our specific intervention strategies to try to and be very intentional about the change that we're wanting to see happen. And so, just as a teaser for the next webinar, you know, when we talk about targeting social norms, we're very strategic about that. How do you integrate personalized feedback? How do you best target injunctive norms versus descriptive norms? How do you treat positive behavioral expectancies versus negative behavioral expectancies related to alcohol use or any of the seeking help for mental health treatment? How do you, in an online environment, it's tough. How do you really strive to develop self-efficacy so that students will adopt and implement problem behavior strategies and become upstanders and take that active engagement in the college community to watch out for each other. And so the next webinar is going to really dig into the meat of that. But you know, the point I want to make, and what I hope came out of the conversation today, is that no matter how strong our science is, that it's only as good, it can only be as good as the translation process. So we don't have all the people that you pulled around the table, Brett, with the specific expertise in these areas and their thumb on the pulse of what the needs of the students are. If you don't have people like Abby who are experts in implementing, not only implementing local, like what are the implementation needs of each campus, but then how do you translate that to meet the implementation needs of campuses that you may be working with? And Abby's been doing this a long time, and I can assure you that she has the expertise to guide other campuses through a process that we've been through, and hopefully achieve the same positive outcomes that the data tell us that we're achieving. And then you've got the research people who are going to continually make sure that the intervention is up to date, that we're taking advantage of the data collection needs and opportunities that are there, that we're using those data to inform everything that we're doing. And so, you know, I hope all of that has come through today. You're going to have an opportunity to follow up with us. Abby, do you just want to mention briefly that if people want to kind of meet us in person, we're going to be at the NASPA strategies meeting in January.
Yes, we will be there, and we'll send out a notice when that gets closer to, and as a reminder, but we'll be there to talk more with you about how we could bring this to your campus.
And we'll have an exhibit booth. Yep. So come by. We'll have some information to hand out. You can have conversations with us about the process that we've gone through and how we can work with your campus. But we're kind of excited. This is our first webinar to talk about itMatters. That we just wrapped up the NIH study this past summer. We're now going to try to maximize our public health impact by taking it out to campuses other than UNC Greensboro. Brett, any final words from Dean? I've seen you wrap up meetings with our own students.
No, I just think you summed it up really well in terms of that collaborative partnership and how critical that is. And again, I want to stress this whole thing of intentional. Everything is done intentional. It benefited our students. So that's one of the things I just appreciate having this opportunity to speak and share our experiences, and we appreciate the work that your team is doing. and we're seeing the fruits of our labor. So I appreciate everything you've done for us and your team have done for our campus.
Very good. Thank you. Abby, any parting words?
I don't think so. Thanks. I'm looking forward to talking to some people about it.
All right. Well, please reach out to us if you have any questions. If not, hopefully we'll see some of you at the NASPA Strategies meeting.
Awesome. Thank you.